So the Food and Drug Administration is proposing new requirements to make it easier for patients to understand their prescription medications. According to the FDA, the guide will help reduce, quote, preventable adverse drug reactions and improve health outcomes. So here with us to discuss is Dr. Sue Decotiis. She's a board-certified internist. Good to see you, doctor. I said to you that as I was reading the background information on this, I was waiting for the list of changes or proposals, and I didn't actually see that. So, what is the FDA proposing here?
Well, they're really just beginning to think about this, but they know that something has to be done because patients don't have the proper instructions. And doctors sometimes can't even read that fine print, right? Mm-hmm. Do you realize that we spend $136 billion a year in dealing with the effects of adverse drug reactions?
Really?
What if we could put that back into our health system, right? Mm-hmm. And 2 out of 3 visits to the doctor results in a prescription of some kind, right? Mm. So probably there are about 3 billion prescriptions written each year in the U.S. So there are many different kinds of things that can happen. Patients take the wrong drug at the wrong time.
Yeah.
They underdose, they overdose, or there are reactions between various drugs. And now that we have patients going onto these platforms and apps and getting drugs, how am I, the practitioner, going to know what's going to happen? I don't know. So we do have in New York State and many states, we have a registry where we can follow what drugs the patients are on. However, not every state reciprocates. So if there's a platform that someone's accessing out in the West, I may not be able to get that information.
Right.
So to me, that's very scary. Now, I practice in Manhattan. I do internal medicine, medical weight loss. So I follow these people very carefully. And my patients are pretty sophisticated, but they make a lot of mistakes.
Yeah.
So, for example, just the other day, a patient came in. Both of them are my patient's husband and wife. And the wife said, Tom is just popping Viagra like they're breath mints. And I'm like,
what?
What?
Well, that's a conversation for another time.
I didn't even know.
No, it's a conversation right now.
I didn't even know he was on it, okay? Why didn't I know he was getting it from a platform? And we don't even have it registered here in New York State. And the guy has other health problems. It turns out the guy has low testosterone, low T. That's why the drugs weren't working.
Whoa.
So when we treat that, we can get him to lose weight, lowers cholesterol. So all of these things come into play.
Yeah.
And the other thing with these new weight loss medications, right? The Mounjaro and the Ozempic, Decotiis.
Yes. And these are all things that initially were being pitched to people who were diabetic, and now all kinds of people are using them.
Exactly. Mm-hmm. And the thing is, they can't always get them because there's a national shortage, right? Yeah. Mm-hmm. So they try to go on these platforms. They don't get the proper care. Yeah. They're not really seeing a physician who's really hand-holding them and telling them what they need to do.
Yeah.
And the other thing are these national shortages, which I'm sure you're aware of.
Mm-hmm.
Now, what is a patient supposed to do? Let's say they're on Mounjaro for diabetes and they can't get it anymore. Mm-hmm. Their physician might not even know that they can't get the medication. So what are they supposed to do? Their blood sugars are going to go up, they're going to get really tired, or they could get tremendous weight regain and hunger. So there's a lot of lack of communication.
So it sounds like, doctor, that you think this is a step in the right direction. What has taken so long to get here?
I just think, it's the bureaucracy, right? And states have different rules, right? So in New York State, we have our own rules for medications, but we have to realize that just in this tri-state area, people are getting them filled in New Jersey and Connecticut and Pennsylvania.
Well, I was thinking about like the snowbirds that go to Florida, all winter long and then come back,
That's right. That's right. So, and we have to realize that, you can die from some of these reactions, okay? And as people get older, it gets much more risky. It's called polypharmacy, people being on multiple medications. And after someone's on 4 medications, be it over-the-counter or prescription, the risk of adverse effect rises exponentially. Now, the other thing that no one really talks about are what about the reactions that people can get from over-the-counter medications? So let's say you have a bad back or a bad knee or headaches and you're popping Advil. That can have bad reactions with a lot of medications.
Yes,
right?
Yeah, so this really does sound like a move forward that's been long awaited at this point. So good luck to your patient's wife as well. Dr. Sue Decotiis, thank you very much for joining us.
That's hilarious.